You are listening to the
World Extreme Medicine.
The World Extreme Medicine
podcast.
Welcome everyone to another World Extreme Medicine podcast with me, your host today, Pavandeep Singh. And today we're going to be talking about diversity in expedition medicine. And we have a great panel of speakers today. And the aim really is to try and inspire and motivate healthcare professionals from a variety of backgrounds to get into expedition medicine. Because it's not your traditional medical route most of the time, which can in itself present certain challenges. But hopefully what we're trying to achieve here is, with our very varied guest panel, show you how actually a lot of us do come from what could be regarded as traditional medical backgrounds, but how we've managed to expand our practice and expand what we do and where we do it. And I'm really looking forward to this. I think we have a vast array of experienced professionals with us. Without further ado, I'd like to invite my panel members to introduce themselves, after which we will talk about their individual journeys and the challenges they face and how they've overcome them to make themselves leading lights, I'd say, in the expedition medicine world. So I'll start with Burj, Mr. Burjor Langdana, dentist extraordinaire for WEM. Please let us know a little bit about yourself.
Sure. Thank you so much, Prav, for inviting me to this panel. So basically, I'm just a dentist, an NHS dentist working in UK in Leeds. I'm also a faculty member for the World Extreme Medicine, and I'm also the professor and lead for the Wilderness Expedition Dentistry module for the master's course in WEM. I'm also the dental director for the Team 5 Medical Foundation. So that's my background.
Wonderful. So not just a dentist, as you started off with. Lovely. Terez, we have Terez Malka with us. Please go ahead and introduce yourself.
Sure, thank you. I'm an emergency physician and a pediatrician, and I work primarily in a hospital in Kansas as the pediatric ER medical director. But then I patch in a fair amount of expedition work and some online telemedicine, travel medicine consultation. So I patch in a few different things.
That's really interesting. Okay, it's wonderful to hear. Shawna Pandya.
Yeah, happy to introduce myself, but I also want to say Terez is being too modest because she gave an amazing talk at this year's World Extreme Medicine Conference on pediatrics in wilderness medicine. So I just want to plug that. So hi, everyone. My name is Dr. Shawna Pandya. I'm a Canadian physician. My training is in general practice, but 100% or 95% of my practice is in rural emergency medicine. I'd also do a lot of women's health. And my interests are in space medicine and space-like environments. So all my publications, operations, and expeditions will be in space and space-like environments. My start into this just started wanting to be an astronaut and then realizing that space medicine is a field. And it's an entire field of study that space is trying to kill you. And we just need to be able to mitigate the risks of the spaceflight environment and keep our astronauts happy and healthy and performing. I have been part of the World Extreme Medicine family for close to 5 years now. Started with conferences. I've been a conference co-host, podcast host, WEM faculty, and I have been humbled and honored to be one of the fellows of extreme wilderness medicine associated with the organization. So really looking forward to the conversation today.
Wonderful. Thank you so much. I'd like to bring in Chern next. Chern, please go ahead.
Yeah, so hi, everyone. Thank you so much for having me. It's an honor to be part of this panel. I am currently a GP, and I'm usually working in Edinburgh, but I am now in Liverpool, where I'm doing my diploma in tropical medicine and hygiene. So I'm quite early on in my expedition career, so to speak. But I am also looking forward to having a conversation with all of you today.
Wonderful. And finally, last but not least, Hareen, please go ahead.
Thank you very much. Difficult to follow all of you. It's great to hear about all your exploits. So I'm Hareen Di Silva, qualified as GP in the UK in 2015. I'm really late to this, actually, in terms of expedition. So only, 2020. But I've pivoted more towards humanitarian aid. So last 2 years been in Iraq, Syria, and Ukraine, working as a medical coordinator. I'm also lucky to be a faculty member for WEM, teaching on the humanitarian medicine course as well. So thank you.
Wonderful. Thank you, Hareen. And I'll just finish up with myself. I'm Pav, an ophthalmologist trained in the UK, and I came across WEM and was lucky enough to join the WEM family about 2 or 3 years ago, during COVID, actually. And I've been accepted onto the faculty, and I've been able to do some podcasts and some teaching. And they sent me to some nice locations over the years. I've also been working with an American-based group called Aerial Recovery, who are a former US veteran-led group that conduct humanitarian aid missions around the world. And I was lucky to be deployed to Morocco after the earthquakes last autumn. And from an ophthalmology point of view, I've been involved with C International, which are based in Florida, and I've done a few cataract camps in South America. All, I would say, possible through WEM, and I think we're going to have that recurring theme throughout, just how many opportunities WEM has given us. I'll go back now to the order we introduced ourselves in. If Burj, you could like to tell us about how the journey started for you.
Yeah, so basically, as a dental student coming from India, it was really easy to get involved in austere wilderness or humanitarian medicine or dentistry. So I started getting involved in the dental camps in really remote areas of India through the Rotaract Club, which is a junior version of the Rotary Club, and then took up a job in Oman. And throughout my career, tried to hunt out austere, remote postings as I could get. So I took a posting in Musandam, worked there, then came to UK. From UK, I joined an incredible organization called VSO, which is Voluntary Service Overseas. They posted me to Malawi, where I had the incredible luck of traveling through the whole country teaching maxillofacial surgery in those days. And then from there, emigrated to New Zealand. And again, when I came to New Zealand, I opted for a beautiful rural place on the west coast of New Zealand called Westport. And there wangled my way into the mobile surgical services, which was an incredible opportunity. Then came back into UK. And again, I got lucky and got into British Antarctic Survey, where I did around 3 to 4 deployments with them to the most incredible places in the world, with an incredible team in the world also. It was a lot of teamwork, which I learned there. And then came back to UK. And when I came back to UK, I started teaching all the tips and the good stuff which I learned, or to make life easier or the job easier while working in austere remote settings. And I did the first workshop with DIM, Diploma in Mountain Medicine, and then convinced Amy Hughes, who was a lead for Wilderness World Extreme Medicine, to let me do the workshop for World Extreme Medicine, and hence got my way into the faculty of World Extreme Medicine, and then started teaching masters for World Extreme Medicine, where I met Eric Linder, who was one of the students, and he's also the founder for Team 5 Medical Foundation, and managed to get into them, which is like a American Special Forces vets charity, which takes you to incredibly remote places where the local people cannot get access to medical or dental facilities, and their only way to treatment is when we reach them and give them treatment. So it was a mixture of luck, networking, and just wiggling your way into the right places. That's how I got in there.
Wonderful. And saying yes to opportunities, I'd imagine.
Absolutely. Yeah. So true. The first opportunity you get, you have to say yes to it. That is your best chance.
Wonderful. And when did you where was your training done? Was this done during training or alongside your initial dental training, or did you find you did most of this after completion of training?
No, this started off alongside my dental training. So when I was a dental student, I did paramedic training courses. So I increased my profile by getting more and more of a generalist, because I knew that when they take you or you go to an austere setting to do these camps, you have to help your colleagues in other parts of medicine and dentistry. And being a generalist is so important. So that is why during dental student days, I did paramedic training and then went on, even when I was doing masters in Max Fax, I still did those dental camps, because the more you do, the better you get and the more skills you develop, which is nice now to share with the others.
Wonderful. That's some really good points. And we'll come back to some of those. And I suspect our other speakers will have similar insights. We'll go to Terez now. Terez, if you wouldn't mind talking to us about your journey into and through expedition medicine.
Yeah, I started from the non-medical side, from the outdoorsy side. I was a competitive kayaker through high school. And so then through college, I taught and led outdoors trips as my side job to put myself through college. Experienced a few accidents and took a wilderness first aid course and just fell in love. So I signed up for wilderness first responder. I needed more. I did a wilderness EMT. And then I did a volunteer year in Israel after college with the Israeli ambulance service, and completely accidentally got stationed in southern Israel in a station that was serving Gaza, and just really was taken by disaster response and working in areas where other people didn't want to go to and where it was difficult to practice safely and effectively, and decided that's what I wanted to focus my career on. So I went back to Israel for medical school, an American program based there that focused on international health and sort of underserved populations, did a lot of volunteering in the West Bank. Had to take a little break from wilderness medicine to get through my 2 residencies in emergency medicine and pediatrics. So just did a little volunteering here and there with an organization that did outdoor camps for cancer patients. And then after residency, worked for a few years just in an ER, really missed the wilderness medicine piece, the disaster response piece. And after I got deployed to Nepal in the 2015 earthquake, I really felt like I needed to get back to it in a bigger way. So I left my job and did a 2-year wilderness medicine fellowship, got my diploma in mountain medicine and my master's in public health. And since then, I've patched together a mix of hospital-based work that pays my bills and supports my family, and as much disaster response, teaching, expedition work as I can build in. So that theme of just saying yes to opportunities and being open-minded about what a career can look like, it's very non-linear for me, and it changes from year to year based on the needs of my family. Is almost the only way to do it, is just being very open to the opportunities. And then I think really interestingly, when COVID hit the US, it felt like it really brought wilderness medicine to me. I started volunteering in really rural areas and in urban centers that were overwhelmed by COVID. And it really felt the same as working in the middle of Africa, where I had a patient in front of me and I had no backup. All the hospitals were full and understaffed, and I maybe didn't have a ventilator or enough oxygen that day. And so I really strongly feel that wilderness and extreme medicine skills are just as relevant within the modern world, all over, with the way our healthcare system has been. So I feel like these skills are really important for everybody.
Wonderful, Terez. Thank you so much. And another very good point you mentioned, I think we'll all agree that what we learn in the wilderness medicine environment, we bring back to our normal day-to-day practice, and it really does help. And the skills that you obtain helps you treat the patients back at home. Terez, a question for you, similar to what I asked Burj. How did you do your expedition work alongside your training, or did it most of it come along after you completed your basic medical training?
Yeah, a little bit of both. There's certainly phases of training where it had to be put on pause because I was in the ICU 100 hours a week. So I really tried to keep my outdoorsy skills, my camping skills, my physical fitness up to where I could do expedition work at a moment's notice. And I stayed on the volunteer list for a few different nonprofits and disaster response teams. But it came and went. There was times in training where I just had to be home focused on training. There was times when I had babies and travel wasn't as much of an option. But whenever I could build in an elective here and there, a course here and there, a personal experience here and there, I tried to keep it up through my training. But I think the bulk of it did come when I decided to go back to Wilderness Medicine Fellowship and then had the time and space to focus on it more directly. I don't think that's necessary, though. I think there are ways to integrate it sprinkled out throughout your training and career.
Yeah, I think you're right. There has to be a bit of a consistent input throughout the years, and I think that's important. I'll come to Shawna now. Shawna, if you'd like to walk us through your journey, please.
Yeah, to Terez's point, someone once said to me at a wilderness medicine conference that you can tell who the wilderness medics are because they will arrange their clinic schedule and they will stack their shifts to be able to do the expedition stuff. Like it is just innate. And I'm seeing a lot of nods, so I think that resonates. Yeah, it's really funny because I have been a lifelong space nerd. I grew up wanting to be an astronaut. You know, my hero was the first Canadian female in space, Dr. Roberta Bondar. And I said, okay, well, you're Canadian, I'm Canadian, you're female, I'm female, you're a girl guide, I'm a girl guide. So now just to be like you, I just need to be a neuroscientist, physician, and then astronaut. So that path was kind of set. But there were a lot of things that aligned to put me on that path. And one of them is just growing up, being outdoorsy, which I've come to realize isn't normal in a typical Southeast Asian background. Like it's just what you grow up with, you think the whole world does, right? And so my parents were avid campers. They were taking us to tent in the Rockies amidst the grizzly bears, you know, when we were 2. And, you know, we would come back in the middle of the night to find that maybe it's not a good idea to store a loaf of bread in your tent. We found out that through firsthand experience. And then I also did outdoor ed throughout all of grade school. So, you know, we would learn to build lean-tos and quinsies and do winter camping as teenagers. And I was also in Girl Guides starting at age probably 6. So you're always doing camping. And then by the time you're 14, you're actually leading camping weekends for 4 to 6-year-olds. So you're kind of given that responsibility of planning the weekend, keeping these little kids safe. And of course there's adult supervision and, you know, making sure they're having a great time camping. So that was so normal for me. It took me a long time to realize that that was something I really took for granted. It was just ingrained in me. You know, did so much outdoor stuff growing up until my 20s. And then when I got into medicine, I initially picked neurosurgery, which was, as Terez pointed out, does not leave a lot of time for other pursuits. And somewhere about 3 years into this program, I realized this wasn't it, and switched to family medicine. And that was just a whole new world because all of a sudden I had time to pursue other stuff. And then that brought me back to wilderness medicine because my first year I attended our residency program's wilderness medicine retreat and loved it so much, went on to do a certification in wilderness medical provider training, and then came back the next year to run that retreat. So that was kind of the wilderness medicine side of it, and loved that kind of, how do you become a medical MacGyver? How do you think resourcefully? And the way that has played into my career now is, I would say actually, yeah, 95% of my work is in rural communities in rural Canada. And so that means that when I tell, you know, my normal is I will have an x-ray machine, maybe 10% of the time I'll have a CAT scan. It's all too normal for extended labs to come back 3 days later. So if I need a CRP, a serum HCG, if I need an alcohol level, that will not come back. So you're really honing your clinical acumen. If you need medevac, they may or may not be able to fly because of the weather, which is especially terrifying when it's a PICU or NICU case. Like, yes, help is on the way, but sometimes not for 8 or 9 hours. So you really learn to hone that clinical acumen and leverage resources and leverage your teams in small resource limited settings. And then where that translated into the space and analog world is I've also been a crew medical officer on simulated Mars mission, on 2 underwater missions. And you know, the mindset of being crew medical officer is you're very much being preventative. You're very much learning to know your crew, getting them to trust you, learning about their medical concerns ahead of time, and also realizing that these are very high performing candidates, and what you would like to medically hold them back for, if they have terrible blisters and you want to hold them back from an excursion, you're just not going to tell you about it. So that was another shift. And then just, you know, being prepared for what's most likely to happen, making sure that you're up to snuff on those skills, that you're practicing them ahead of time. And then also kind of the skill set or the mind shift set of how you practice medicine. So for example, if I'm in an emergency room setting, I'm not really going to care about an abrasion on your knee. Like most of us would just walk that off. But when you're the crew medical officer, you are the first point of contact for all of your crew. And so they will come to you for every affliction, and it's your job to just say, hey, I'm here for you. Whatever you need, you know, you have a splinter, I'll take it out. You just want to be, you had a fall and you just want to be checked out. I'm here for you. So the next transition, and you know, that's the bulk of my work, but I made my first transition into conflict zone medicine when I was in Ukraine with a Canadian organization in 2022. And it was a lot of primary care, it was a lot less emergency medicine, and it was really those small group dynamics that was the biggest success criteria in that scenario. Because to be safe, we stationed in Poland, and then we would travel into Western Ukraine and the border region and some of those Western towns every day just to keep ourselves safe. So those were long crossings. Our longest crossing was 7 hours in a car because of the backlog to get into the country. And you realize how much the crew dynamics make a difference as to whether you have a good day or a bad day. Because, and this is something that I just picked up from my analog and space-like environment missions, is like, at the end of that 7-hour day, the car and the crew I was with, we got along so well that it was still just another day, whereas some of the other cars were not speaking to each other, not speaking to anyone. They were just done with the day. Because the other part of wilderness and expedition and space medicine is like the preventative aspects, the boredom aspects, preparing for the mundane and being able to deal with that. So it's been an amazing journey, and I just feel like I'm getting started.
Thanks, Shawna. Can I ask, do you consider yourself lucky to have had the non-traditional upbringing, as you mentioned? And do you think, had you had a more traditional upbringing, your path may have been somewhat different?
Yeah, totally. It's like when you become an adult and you reflect on the choices your parents made, like it's so easy to take them for granted. But my parents chose to pack up everything they had in 2 suitcases each in the 80s and emigrate to Canada from India. And that in and of itself afforded a lot of opportunities, both in space and medicine, that just happened by virtue of being born in a different country. So I'm very mindful of that. And then, you know, them choosing to be outdoorsy, you know, it's so hard to fit in that time, as Terez was mentioning, in adult life, and knowing how fun and how freeing and how nice it is to be outdoors. You know, having that experience is kind of that pull to come back to it. So 100%, I am really lucky.
That's great, thanks. And we'll come on to that topic a little bit later as well. Chern, I'm going to come to you now. So if you just talk us through your journey into the world of expedition medicine, please.
Sure. So I'm Chinese Malaysian. I grew up in Petaling Jaya, which is a little town near Kuala Lumpur, the capital. And I moved to the UK for medical school. But just a bit of background about how I got into medicine. So I've never really thought about being a doctor all the way up till maybe a few months before applying for A-levels, because I always wanted to be a policewoman. And I sat down with my mom, who was my chemistry teacher at that point, and we had a discussion about my career. And she was like, "Oh, sure, you can be a policewoman, but think about getting a degree or studying before going into that." And so I was tossing up between law and medicine, but had some exposure to camping and being outdoors, and went to some rural communities and worked out that I actually really enjoyed working with people. And so swayed me a little bit. So without biology, applied to A-levels, and then decided to come to London for medical school. And at the back of my mind, I've always wondered if I wanted to do a bit of army medicine as well. But I think my issue was I don't think I had anyone that I saw who looked like me doing that. So I think I kind of shelved it and sort of just went through the usual medical school training. And so one of the reasons that I reflected on and why I got in so late was because I was on a visa, so which meant I didn't have the luxury of taking time out. So most trainees in the UK would do what we call F3, F4 years. So after your foundation years, you take some time out, figure out what specialty you wanted to do, and perhaps do something interesting. Whereas for me, I had to go straight into a training program, which is why I chose the GP training program, which is something that I'm passionate about as well. But that's how I ended up being a GP. And then just going into the expedition medicine journey, which I said before, I'm just starting at. I went on one of the 1-week WEM courses in the Lake District last year, and that has changed the course of my life completely because I met really inspiring people, heard about careers that I never imagined possible, and just people asking me why not do something completely different. So I left my job at that point as a GP partner and decided that I'm just gonna leave this career path that I know and start on this journey. So the exposure to different career paths and adventures just started from last year. I decided that I wanted to increase my fitness levels just in case I wanted to go on expeditions. So I've been focusing on that. I did quite a few obstacle course races, and one thing led to another. I've now signed up for an ultra marathon obstacle course race in Morzine this year, which I'm training for as it happens. And on the back of that, actually, I did a diploma in personal training as well. So because I found that I was quite passionate about this and how it could be used to help patients as well, I'm quite, I found that fitness and exercise is a great way to help patients' well-being. So I did that last year. And I just got outdoors a lot more, did a lot more bouldering, went out a lot more with my friends, did some solo hikes. So it's just been really freeing. And again, just one thing led to another. And now I'm doing the diploma in tropical medicine and hygiene, hoping to do more interesting things. And also, I think some of you had quite a lot of experience when you were younger. I did go on trips before, but I didn't feel confident in my outdoor skills. So again, throughout the past few months, did some navigation skills, did some scrambling courses. So the last few months have looked very different to how I was a year before. So it's quite exciting. I've been open to more new experiences. I went skiing for the first time in my life this year. So I'm a fan. And my friends are just wondering what else happening to me, as if I have something to get out of my system. But no, I think this is a new exciting life that I'm really looking forward to. So that's my journey so far.
Wonderful. I was gonna say, like, what is next? God, you're just like doing everything you can get your hands on, which is great. It was quite a brave decision to because the expedition medicine course that WEM run, I'll plug that here. It's a great course because I went to that in Keswick, Lake District, right? Was it? Yeah, that's the one.
That's the one. Yeah.
And it was quite a brave decision, however, for you to just then after that just say I'm gonna quit the GP practice. What factors did you weigh up in making that decision?
Well, it was on the back of a few life changes as well. So I think that the snowball was just building up, and I think it was probably just looking at how the different faculty members were just so passionate about what they did. And it's so nice to see like, oh, they really love what they did from day to day. And I think I missed that because I feel I've always had a touch of it, but never really, never really watered that part of my life. And so I feel it's always been part of me, but I've never had the opportunity to. And so it's just the right time, just timing, everything worked. And so I just decided to sack it all and join all of you guys on this exciting journey.
That's it. Sometimes you just have to decide. Yeah, go ahead, Shawna.
This group is making me feel like I'm not doing enough with my life, and I just want to do everything now. I want to go to New Zealand and hang out with Burj. I want to do an ultra marathon. I don't know if I'm ready for obstacles. I just want to do it all. Thanks for the inspiration.
I'll move on to Hareen. Hareen, if you want to talk to us about your journey, I'm sure we'd love to hear your journey through expedition medicine as well.
Yeah, no, do you know what? It resonates a lot of what everyone said. So I was born in Sri Lanka. I came here when I was a year, and it just resonates with what Shawna said. Like, my parents moved at sort of almost the start of the Civil War, and I was just that has an impact on me in my future, obviously, and just afforded me so many opportunities. So yeah, I grew up in London. The most rural thing I saw was a bit of a muddy field behind the school. So I'm a proper city boy. So I had no exposure to anything outdoors at all growing up in Hackney, East London. And so I went to medical school because coming from a South Asian household, South Asian family, it is pretty much kind of limited. Looking back now, I was thinking maybe I wanted to be a chef back, but that was never going to happen, I suspect. I'm decent at cooking now, but definitely not at the ability to cook well. So I ended up in med school at Barts in London, and then integrated actually in sports and exercise medicine, and got to do my project with Arsenal Football Club. They're looking at injury rates, and I thought, oh yeah, I'm definitely going to become a football team doc. This is what I want to do. That then F1 and F2 hit hard. So basically, I did my foundation training, and I met an absolutely wonderful woman during my foundation years, and that kind of shaped where I was going next. In terms of, she got a job which only had 3 training posts in the whole of the UK, and she got one in Sheffield. And I'd always wanted to do emergency medicine as well and pre-hospital care, but I realised if I chose emergency medicine with the view possible pre-hospital, I'm going to have to go wherever the training number was. So that was back then in 2010, 2011, 12, whatever. So I decided to go down general practice route. It just afforded me some flexibility to choose where I wanted to go, and it worked out well. Could have been a terrible decision, but I absolutely fell in love with general practice, loved the variety, and wasn't jealous of my friends who were struggling with nights and on calls and all of that sort of stuff. So it actually worked out quite well for me. And so I did that qualified in 2015, did that for a couple of years. And in 2019, I got offered a partnership by an amazing practice, absolutely loved them. And that scared me. That was one of the most scariest things I realized, because I'd probably be at that practice for like 25, 30 years. I was like, what have I done so far with my life? I'd be financially stable. So I was like, oh, I can't do that. So it's like, what can I do? So I came across a different organizer of wilderness extreme medicine courses, which I don't think I'm allowed to plug at all. So
you can mention, I mean, you can just
there are others. You can Google them.
There
I'm
are
sure,
others out there.
So I did that, and I was like, oh, I quite like this. After that course, I ended up going with Operation Wallacea on my first expedition. Great little introduction into expedition medicine, working in, volunteering in Dominica for a couple of weeks in a jungle camp, looking after high school A-level students who are about 17 to 18 years old. Sort of sunburn was a major issue there, a few scrapes, etc. So it was a great dip in the ocean to just get to grips with this. Then I came back, did another expedition in Costa Rica, and I was like, oh, I really like this, but I feel like I want to use my medical skills a little bit more, because I'd actually done a lot in health inequalities when I was working. So I was working in South Yorkshire, so Doncaster, one of the most deprived areas in the world. So I used to volunteer in, I helped set up a drop-in centre for homeless people, a clinic. So I was working during my lunch breaks, just staffing that with some nurses and third sector organisations, the social housing association, etc. And then I was like, oh, do you know what? I really love health inequalities. I want to do more, maybe work in a bit of policy. So I decided to do a master's in public health part-time as well. And did that, and I fell in love with global health during those modules. And I had an amazing lecturer called Andrew Lee, who's a senior member of UK HSA, absolutely fantastic person. Works in disaster response, and I learned so much from him. And then I decided maybe I'm going to pursue global health and humanitarian aid. So a lot of what most people who end up from Europe end up going to Greece as their first sort of foray into humanitarian aid, worked in Lesvos in the Karatepe 2 camp there. That was after the Moria camp burnt down. And then I came across another organization was there called CADUS, who I've been with now for a few years. And I applied for a job with them to go as a clinical doctor to Syria. I got rejected from that job. And then I got an email like a month later saying, you're not the usual person we go for because you're a general practitioner. We usually go for hospital doctors, but everyone's stuck on the wards during COVID and no one is allowed to leave their normal jobs. And so that was the luxury of being a general practitioner. And at that point, I'd left my practice and was just locuming. And I just had so much flexibility. I was like, I'm there. Had 2 to 3 weeks prep before the courses that I needed to do. And I went out there for 4 months. And it was mainly capacity building, so teaching mostly, because I hadn't been in hospitals for ages. So it was really interesting to do a learning needs assessment of the organization, the staff there, and then just fill gaps which I felt I could. And if I couldn't, I spoke to other organizations who could put on teaching sessions, and I absolutely loved it. I came back, and then they asked me to come back the next year to be the medical coordinator for a year, and that was really humbling. And I was really lucky I had my public health masters there, so did that for a year. So that in Syria it was Al Hol refugee camp, the world's most dangerous refugee camp at the time, and it was really difficult. So I was managing a 24-bed inpatient facility, which was 24/7 in a refugee camp for 56,000 people, and that was the only 24/7 facility available. So we had different, obviously, primary healthcare centres and day hospitals, etc. But definitely just one of the toughest things I've ever had to do, sort of to manage staff. Never managed staff before, working for huge, like a budget of $50,000 every couple of months, managing that for all of the medication that we needed every couple of months. And then it taught me a lot. And then after that, in 2022, I was in Ukraine, so East Ukraine, with CADUS again, doing teaching, actually. So teaching trauma stabilization, an adapted version of the TCCC course, but mainly for civilians. So doing that, and then doing medical evacuations from Kramatorsk as well. So I've interspersed various expeditions in there as well. So Gough Island for Royal Society Protection Bird for 6 months as the number 2 medic for the first 3 months, and then on my own as a number 1 medic for the next 3 months on a place which is 11-day sail from South Africa. So as Shawna talked about, you've got to rely on your clinical acumen and be able to manage things without any resources at all, and be confident to manage things, and just keeping your skills up to date is really important as well. And then loved that, actually. And then after coming back from Ukraine, I'm jumping forward again, I needed a break from anything medical. So I ended up volunteering at the US Fish and Wildlife Service on Midway Atoll Island for 3 and 4 months. Tiny Pacific island, famous for the Battle of Midway in World War II. And we was on a species restoration project for the albatross there and a few other species of bird. And essentially my job was just to help pick up trash. That was it. 3-4 months, every morning, driving my 4x4 Kawasaki mule around the island with my crew, just picking up trash. And then as usual, with all expeditions and stuff like that, you end up having to do a lot more stuff. So I helped a medical team that was already in place. Then I ended up doing other things such as counting birds, doing transects with the biology team, and then vet care or husbandry, basically. So orogastric feeding of ducks that we had in captivity. So those medical skills definitely came in good there, and in giving ducks injection. We had an outbreak of botulism as well, which was probably one of the worst things I've seen. Like sick animals just get me more than sick humans for some reason. It was really sad, but we managed that outbreak. So intramuscular fluid injections, calculating all of that. So yeah, that's basically it. And one of the key things I realized is when you do exped, you have to learn how to adapt and learn different skills to help out all the other teams out there, because you're an invaluable. Your job is to be on call 24/7, but a medical issue is unlikely to happen a lot of the time. But you have to be able to be comfortable helping other people and being a nice teammate. So that's it from me.
Yeah, that's some really good points there, Hareen. I'll ask you a question, and I'm guessing this will be on the minds of the listeners as well. Throughout all of that, what do you do for income, or what did you do for getting food on the table?
Yeah, so this is one of the things which completely which will resonate with a lot of people. One of the things I did was my biggest income was my mortgage. So I've rented that out my house and moved back in with my parents. And because I've spent a lot more time abroad, it actually worked out well. I locum here and there. I have to maintain my performers list registration as a GP in the UK. So that's 40 sessions, 20 days a year to maintain that. And so I locum, but thankfully my most recent humanitarian aid jobs have all been paying jobs. So that's helped. But again, that's sometimes it's a rare find, but I'm very lucky with the organization I've worked with.
Very good points. And I resonate with what you mentioned at the start. And because I'm host, but I'm also part of the panel in a way. So my journey into it was somewhat similar in the sense that I'm born and raised in Slough, which is a town just 20 minutes west of London, 30 minutes west of London. Never done anything outdoors. Did a bit of martial arts as a teenager, started going to the gym at uni, as you do. Started medical school, was standard, normal. Went straight into F1, F2, actually, like Chern, you mentioned people do F3s and F4s. I didn't do any of that. Straight into F1, F2, then straight into specialty training in ophthalmology, which was, about fourth year medical school, I had my placement in ophthalmology, and that was the only thing I kind of liked. I liked using the tools, the gizmos, the gadgets, and I could see myself doing the surgery and having the life of an ophthalmologist. So I went through specialty training, quite a standard route, but somewhere along the line, then I kind of I became a bit disenchanted with the whole, what I call the treadmill of the NHS and the kind of public sector, well, just the system as it is. And I was looking for more. I didn't know where to find more. I then ended up going on like this kind of boot camp thing run by UK ex-military guys for a few days. And that kind of changed me in terms of my outlook on life and my kind of relationship with suffering. I was always looking for finding more in myself. I think it was Shawna who mentioned one of her heroes was one of the astronauts, and then Shawna, you said you kind of looked at what that person had done and decided I need to do those things. So you make a hero, you find a hero, you find what makes them a hero, and then you break it down and try and do those things. So my journey was a physical journey. I wanted to become someone who was capable and able to do stuff. And I ended up on this military camp thing. And I came back, the world just looked different in terms of how I perceived things, how I dealt with problems. And then WEM, I had always known about WEM, and then COVID hit. WEM sent out an advert about requiring people for COVID tests on a film shoot somewhere near Oxford. I just said yes. Ended up working with one of the WEM faculty. It went well. I got another job with WEM, and during my annual leave, so I was going through training as a normal UK-based specialty trainee, which is important because I think a lot of people and people I met who've attended the conference as well think we all have to take loads of time out, which you don't always have to do. WEM afforded me lots of opportunities, and then I was asked to join the faculty and do teaching gigs and all that. And it was the conference in Edinburgh, which again is a great hotspot for networking and meeting wonderful people like yourselves, where I met someone called Aaron Acey, who's a chief medical officer at Aerial Recovery Group, United States. He gave a really moving talk on actually human trafficking and child trafficking. And I had always grown up wanting to try and make a difference in life, and I'm sure like the rest of you have. And it just resonated with me, that the kind of ethos he had and his organization had. And I looked into it and I found that they offer training in humanitarian medical aid. And I was like, well, I'm just an ophthalmologist. But, and like Burj was saying, Burj said, Burj, you trained in paramedicine to make yourself more capable and to provide generalist capabilities. So I went along to their training, and actually, yeah, I had my ophthalmology stuff, my knowledge, but I still maintained my general medical knowledge from medical school, F1, F2, and we trained further in that. And I found myself being a capable outdoors doctor as well. So I've got my specialty experience, which helps me, and I've been lucky to be able to go on cataract camps, which only came about because I'm always talking about expedition medicine to my friends, to my fellow trainees. And one of my friends happened to know someone who was in Spain and was going to go over to Bolivia a few years ago. And he said to me, "Oh, Pav, do you want to come? We're doing a cataract camp." And I said yes, which is the most important to me. You just got to say yes, right? And went there for 2 weeks, and we were operating in a quite low resource theater, but it happened to be, we happened to have the time where I was able to be taught new surgical techniques, which doesn't tend to happen on those type of camps. You're meant to have gone there fully trained, right? But we were doing kind of third world type of surgery, which isn't taught in the UK. So I was really lucky to have the opportunity. Now I'm capable of doing it on my own, thanks to Mr. Jeremy Joseph, whose name I'll mention. He's a great consultant. He's the man who trained me. And now more things come through. So you get more opportunities, and one thing leads to the next. And I think all of us have shown that in the journeys you guys have mentioned. There's a few, we have got, someone mentioned it. Fitness has come up a lot, guys. So I'm going to just talk about that. And I'm really happy that you guys have, it's like you can see that in your own journeys, you've noticed how important fitness is because of the environment we're operating in. Because you can't just have your medical knowledge. You have to be capable, right? You have to be physically able-bodied member of the team. What do you guys do, or what's your kind of routines, would you say, to maintain a degree of physical preparedness as it is? And anyone can come in now, so I'm just not going to pick anyone. So go ahead, whoever wants to answer that one.
Sure, I can chime in here. So by virtue of, like, it's so funny because I think if I hadn't been thrown into all these things as a kid, I think I would probably be very lazy. But like as a kid, my parents put me in everything. They put me in Girl Guides, they put me in skating, they put me in soccer. Like, you just keep your kid busy. And there's no knack and there's no aptitude. I was just so uncoordinated growing up. But then, when I was a kid, I was also very ambitious, and I made a bucket list of things I wanted to do. I did this when I was 10, and one of them was get a black belt in something. And so by the time I was 15, I just all of a sudden one day woke up and said, what have I done with my life? I haven't even taken steps on most of these things. And so then I said, okay, let's do it. Let's join Taekwondo. So I started in Taekwondo when I was 15. And, went on to become a competitive black belt. I'm a second degree black belt now. I've competed and medaled at the national and international levels. I last competed in Worlds in 2016. Then as part of that, like, you dabble, you look for, it's saying yes, look for other opportunities. I heard great things about Muay Thai. So then cross-trained in that, and then would go to a Muay Thai camp in Thailand to train. And I did that for 3 years in a row and fought in my first amateur fight there. So, then like what I came to realize from that is like, there really is a sport for everyone. If you think you're not athletic, it's because you haven't found your niche. Even if you love going on walks, if you love going on solo hikes, there's something there for everyone. So for me, it was martial arts. And now I travel in so extensively. It's hard to find consistent martial arts training. So now my happy place is the gym. And so every single day, even like I know, because I have my gym here in Edmonton, but I also know all of the rural gyms in all of the towns I go to and strike a deal with the gym manager to get access. Sometimes for a good rate, sometimes I pay full price, but it is, that is my investment in myself, and it'll be 60 to 90 minutes of cardio plus or minus weights every day, assuming call isn't too busy. And it's just sort of like this is the thing that makes me happy. And it just, you know, it is that me time, no matter how much else is going on, as long as the hospital isn't demanding me. If it's a day working remotely or from home or in meetings, it's like, okay, we're going to take the pause. We're just going to go to the gym. So yeah, that's what my journey's been like. It's been great. It's, you know, it really is. There really is truth to the concept of physical therapy and physical fitness being therapy.
First of all, I think Shawna's now who I'd like to be when I grow up. Speaking of inspirations. But I think the reason it's come up is it's so important as the medical provider in a group that you are not the weakest link on the expedition. And as a lot of us have mentioned, sometimes these jobs come up really last minute because someone dropped out. And that's certainly been my experience. So just being physically ready. I just got asked to do Kilimanjaro 2 weeks ago, and I got about 10 days of advance notice. So had I not had at least a little bit of a physical base, I would have been the slowest one on the team, and then I'm no use to anybody. So it's very important. But on the diversity and inclusion side of this, a real barrier to entry, I think, for those of us with full-time jobs, with financial obligations, with family obligations, I can speak to that very personally as a single mother through my whole career, that if I'm working a 12-hour shift and then making school lunches and doing forms for my kids' activities, literally where and when can I get to the gym? And that's a real challenge and a real stumbling block for some people to enter. And then a lot of us do locums. I've done that as well. And traveling and living in the middle of nowhere in a little rural town where it may not be safe for me to be a woman alone at the gym at 1 a.m. or even in my apartment complex or hotel alone at the gym in the middle of the night. There are just a lot of barriers there. So I found I have to make it almost a not fun priority where I just have a strength training program, a cardio goal that I have for the week. And even if I'm miserable and tired, even if it's just doing some Pilates in my living room, that's a non-negotiable. So I am physically prepared to be a functional team member, but it's not going to look like what I would like it to look like. A lot of times it is exhausted after a 12-hour shift, forcing myself to do some yoga in my living room or go down to the hotel gym and do some running. So there's a challenge there and an opportunity there. And it does take some discipline, I think, if you want to do this at a high level, to make sure you're always physically ready to support a team and not need support.
Thanks, Terez. Really, really good points. Like you mentioned, we don't want to be the medics that are a burden on the team, and we want to be able to pull our weight, right? But I'd say go one further. I've always felt like I want to be the best in that team physically, if possible, right? You want them, because they'll look at you, think, oh, he's just a medic, right? But then you turn up and you can lift more than everyone, you can carry everyone around, and it just gives you a bit more kudos. And in a way, kind of touching on the diversity aspect as well, you know, people might judge you for whatever reason, but they cannot judge you when you can perform. And I think physicality and having the endurance, and you know, you can win a lot of respect because you've done the work to get there. I wanted to ask you, Terez, actually, because you mentioned earlier as well, kind of digressing from the fitness aspect, but you mentioned being a single mother and just the very important, and I think the responsibilities that are vital to our society that a mother and a woman carries. Would you like to talk about those and how you've managed them and done all the stuff that you've talked about so well?
Yeah, it's certainly been an evolution over my life. I'll be transparent. I'm 42. And I had my first child in my late 20s. And I remember a colleague saying to me, like, oh, you won't want to do that expedition stuff anymore once you have the baby. And I was horribly offended and thought, no, I'm me. I will always want to do this at this level all the time. And that's been semi-true, but I've had to have grace and patience that there's just going to be seasons of my life that are sunsets where I'm just going to be focused on the kids temporarily. If they have medical needs when they're babies and toddlers, now they're preteens, there's new needs. I'm going to have patience for the 6 months, year that the family has to be my priority, knowing that there's also going to be periods of stability where I can go back to focusing on the stuff I'm most passionate about. And as I've gotten older, I've gotten much more patient with those lulls and less like itchy to get back to it, because there's so much room in life for all those things. But it's always a compromise. Wilderness medicine doesn't pay as well as working in a hospital or a clinic. So I know that there's a sacrifice there financially to the time I take to do the work I love. And there's a sacrifice in just time at home on the couch watching movies with my kids that I talk to them about why it's important to me. I hope I'm demonstrating to them values that are important to me and they understand that. At the same time, if they ever came to me and said, I need you to not leave right now, I would have to take that very, very seriously. So there's always a little bit of a balance and a compromise, but I think having patience, knowing that if an opportunity doesn't work, another cooler one is going to come up, or that opportunity will come back in a year or two. And I've always found that to be the case. When I've said no to something that I really regretted, something very, very cool has come up, maybe in a totally different time frame or different location than I expected it. And I think the other piece of that is picking a co-parent and a partner very carefully. I know whenever I travel, even though it's my ex-husband, I know my children are safe with him. I know they're happy. I know they're well cared for. I know he can handle a lot of the day-to-day. And I know not all women have that. And I still do a lot of the mom stuff. I make the doctor's appointments. I'm in charge of most of the finances and the school activities, but I also know that I have a co-parent that I trust and that my kids are safe, healthy, and happy when I'm gone. And I think if I didn't have that, my career would have to look incredibly different.
It's really good. So patience, wisdom, and maturity, I think, is 3 key assets you've kind of touched upon there. I want to ask the group now about another aspect of getting involved in conducting expeditions. Have you been in a position where people around you have told you not to do it, or it can't be done because you're not meant to be doing stuff like that? And how did you overcome it? Go on, Burj.
Yeah, my parents, because like a typical Indian family, it is like what car you drive, what house you are, what job you have. And then I was just looking at all the stuff that you guys have said, and I was thinking my parents would have cringed the fact that some of your left GP practices and went out wandering. Shawna, instead of staying in a nice, comfortable place, was under canvas with bears. And it was just not the Indian ethnic way of thinking. And we all went against that. And some of Shawna had lovely parents who obviously were truly in the thick of things. But like some of our parents would have cringed at the very thought, and the fact that they still gave us the blessings to grumpily and very, not very willingly, to go through with what we loved has made us who we are. But yeah, it would be my parents more than anything else. But finally I convinced them and they saw it. They were worried, but they agreed.
So, Burj, to your point, I didn't tell them I was going to Ukraine. I told them I was going to Poland. I didn't tell them I started flying until I fell asleep with the pilot's manual on my face, and my mom just picked it up and looked at me and said, "Oh, so you're starting to learn to fly now." And then I definitely didn't tell them about skydiving until after I got my solo lessons. So there's like a very selective information channel that goes on with the Southeast Asian parents. I don't know if Hareen had the same experience.
Yeah, so my parents are long suffering, and they've grown to realize that it's part of my personal values. And I was going back to what Terez said about teaching her children sort of values that she has and giving good example to them and saying, this is important to me. I'm doing great things out there. And I think that they've learned, they've seen that as well. And I've always said, well, I always blame them. I said, you guys taught me to leave the world in a better place than I arrived. So I blame you completely for that, for sending me off to do humanitarian work. But now it's mostly outside of sort of the close family circle where like I haven't got a child, I haven't, and it's just like, what's going on? This is not what South Asian men do. So It's difficult. Honestly, it is difficult because there are a lot of outsiders. You're going to get a lot of outside noise, but you have to put that to the side and realize and be true to yourself and your own personal values, which I've always been very open and being in touch with my values and being happy through finding things that make me happy that are close to my values.
Wonderful.
Can I just chime in there?
Yeah, go ahead.
I'm just grateful to my parents as well because they are in Malaysia at the moment. And so I guess slightly different to some of you that my parents are back home. So trying to balance the free time that I would have with doing stuff that I like and even spending time back home with them as they age as well has been quite difficult. But I think I definitely inherited some of my adventurous spirit from my parents. But I think they probably didn't have the opportunities that I had. So I'm definitely forever grateful for being given this, and I don't take these chances lightly at all.
That's really good. And I think what I've noticed from all of us is this shared desire to make the world a better place. And it's true because you grow up and people tell you, your parents, your elders tell you stories about great heroes of the past and all sorts of historical things, and you're like, well, I want to do it. And then no, you just go to school and university and then get married and have some kids and then get a bit fat and then just stay at home all the time and don't do anything. But you realize when they realize you want to be one of those adventurers, it's kind of hard for them to accept. But the fact is, when you go and pursue your dreams like you all have, you find your happiness, you find your fulfillment. Is there anything you guys would have done differently on your journey so far?
I think one comment is one I just put in our backstage kind of green room chat is just learning to give yourself grace. And I often say this, publicly is, you can be hard on yourself in a way that's destructive or a way that's constructive, right? And if you're not doing it all, like I think we're all at the same mold here that it's like, oh, I need to do more, and maybe sometimes that self-talk looks like I'm not enough rather than, oh, what's my next move? So just, stop putting so much pressure on ourselves and, just, being more curious to why we're feeling like, we're not enough rather than hard and judgmental on ourselves. I think that's a lesson that I've learned a lot over the past year. And I think, there's so many pressures, there's so many high achievers, there's more and more with every generation. And, using that as a way to achieve more without tearing ourselves down, I think is a lesson that comes with age, but maybe we can start teaching earlier and earlier.
I think Shawna makes a great point there, is giving that grace. But what I've learned is I was going, like the last 3-4 years, I was going at such a rapid pace to try and fit in so much before I was 40. But I realized I don't need to. If I keep my fitness levels up, if I keep learning more and gaining more experience with online courses, etc., there's no reason why I should stop this when I hit 40. Like, obviously, that's not the case, but that's what society tells you. That you get to a certain age, you should be thinking about retiring or slowing down. That's not how it is. And I think times have just moved on so quickly to be more inclusive of age, which is really important, I think, as well.
Yeah, it's interesting. As you were asking about any critics, I just thought that I give myself a fair amount of negative self-talk when a new opportunity comes up. Both, am I good enough? Am I strong enough? Which is maybe a little silly at this point in my career, but I still do it. And then also, should I do this? I have a full-time job now. Is it a wrong, bad use of my time to go to Nepal for 3 weeks in the fall? So I almost do more of that negative self-talk. My parents do the bulk of it, but I add on to it. I wouldn't change a thing about my career looking at where I am now, but if I could give younger me advice, it's to be a little bit bolder, even if it's like foolhardy boldness, where there's no harm to applying for something you're not sure you're qualified for. The worst thing that happens is they say no. And if they say yes, you have to trust yourself to step up to the plate. But I've gotten so many opportunities that I applied to, sent the email, thought I was totally underqualified, forgot about it. And they get back to me a year or two later and I have to step up to it. And I wasted a lot of years not applying for things because I was embarrassed or unsure or doing that negative self-talk. Like, no, I just have to focus on my day job and my regular career. And I think opportunities passed me by because I was doubting myself and being timid. And again, the worst thing that happens is they say no, and that's not so bad. You're in no worse shape than if you hadn't applied.
And that's an important point about diversity, because they've actually done studies on this, and it's something that we do to ourselves, right? We just convince ourselves that we're not qualified, whereas that's not really seen with male applicants. So I think having conversations about that's really important, and saying, you know what, the worst that can happen is they say no, right? No one's going to say, what are you doing applying for this? Never apply again. Like, no one's going to tear us down. We already do that to ourselves. So just being bold, like you're saying, Terez.
Gosh, and a lot of my rejections have turned into yeses when I least expected it. Like, no, we don't have any spots for years and years and years. And then 5 years later, they're like asking me to be the medical director. So even what feels like an initial ego blow sometimes turns into a positive later on.
That just makes me so happy to hear those stories. Like, yeah, you take the failures, and it just turns into a massive win at the end. I also think everything we mentioned, everyone, all the stuff that you guys do, when you face your fears voluntarily, if you just take on a challenge and you get somewhere, you're building your own confidence. So when you look back, when you're about to face a new challenge and you look back at how far you've come, you've got something actually there to say, hold on, I can do this. I've done other stuff that I didn't think possible before. And you become your own self-fulfilling positive loop. And I guess my advice for youngsters out there listening is, we all started as, students at some point. You're not born as a super duper expedition medic, but you have to believe, you have to dare to dream and take the little steps. And when you look back how far you've come, you see that it was just taking the opportunities, facing your fears, that built your confidence and got you where you are.
I just want to add one point about that's really important when it comes to, why do we all come to expedition medicine other than love of the hard things, the fitness, doing impactful things. I think the other thing is, this being a diversity podcast, is the two commonalities I've noticed in austere environment, extreme environment, wilderness medicine, and space medicine, and more so space in general, is like the passion and the inclusivity, because people are so passionate about these fields. They just want to bring others along on the ride. And definitely, I think all of us will have had our own less than stellar experiences in medicine. Medicine is still quite toxic, and we need to do better, especially when it comes to not tearing apart trainees, being more gender and race inclusive. I think all of us have our own horror stories. I certainly do, but I haven't, knock on wood, I haven't seen that in these worlds. It's like, I'm passionate about this, you're passionate about this, what can we work on together? Let's work on this, and this. And I think that's, I don't know how we replicate that, but it's just sort of, I'm so excited about this. I want to bring you all with me on the journey. That's my own how I feel. And that's, been my experience when I meet others in this field. And I think that is something that's, so key to recognize.
Yeah, that's a really good point, Shawna. Yeah, the expedition medicine field, I think, lacks any kind of toxicity. Is it? And I've often asked myself that question: why is it? Is it because the individuals in it are just drawn to help others rather than making a name for themselves? Or I really don't know. But yeah, you're right. It's a really good point you made.
Can I just add something as well? I think there are some things that are external that we can't change. So there are systemic biases or things that we don't have a say in, but there are things that we can do as well to change the narratives. And so what I found, which what some of you have mentioned as well before, is just to do things that build confidence. So like you were saying, Pav, just putting yourself out there. So as part of my crazy 1-year change, I've also started doing open mics, because I thought, if I'm going to put myself out there, just going to sing, just going to play an instrument and just like go for it. And I think that has really helped me in my day-to-day as well. And then going for all these races, just doing stuff, like you said, that you never ever think of doing, just building resilience, building confidence that transfers into your day-to-day jobs and your day-to-day life. So yeah.
Well, this is really good. Yeah, really good points, guys. I think when you find yourself in a position where you might be the standout or the kind of the different one, I've always embraced it. And that might just be the way I've been brought up, I don't know, but what's helped me get through things is not to see it as a negative, but to see, just to say to the world, look, here I am, right? And take this as you will, but I know I'm going to give it everything. And I think I can see that reflected in all of you guys and in the wider expedition medicine community. And that passion really comes through. If that's anyone have any other points that we may have missed and you think would be useful to talk about, or anything you want to mention about your journeys? Shawna's saying we need a part 2. Yeah, maybe we could.
Well,
yeah,
one
guys,
thing I was going to say, it's not too late to start. So I think as compared to most of you, I am quite late to the game. I finished my GP training, done it quite a few years ago, but it's never too late to start, and just go for it. Like all of you said, just be prepared, prepare yourself as much as you can, and be ready to say your yes, and you don't know when it's going to come. So yeah, that's mine.
It's a wonderful way to end. Anyone else have any closing remarks? Go on, Burj, go and give us some words of inspiration.
Only one, have a sense of humor and enjoy every bit of it. Yeah, I mean, it's a lovely field to be in, and we love it. So, I mean, and you can tackle anything with a sense of humor.
Just gratitude. Thank you for having me part of this conversation. It was amazing. And again, I feel like I need to do more with my life after this conversation. So just thank you.
Terez, some final words from yourself?
Yeah, I feel very inspired as well. And I agree that we could probably talk about this for another hour at least. But I totally agree with what Chern said, that there's so much life and so much opportunity, and there's really no hurry. There's space for all those things. And it may not look at all like what you thought your career would look like, or what you maybe wanted it to look like, but it's never too late to dive in. And it's kind of amazing what the opportunities will turn out to be if you're open to it, not looking at all like you initially thought it might look like.
Great. And Hareen, go ahead for some final words, please.
Yeah, no, it's just echoing what everyone said. Like, I think going back to what Chern said earlier on, for her, there wasn't someone who looked like her when she came out, started with this. And for me, it's great to see on the podcast, there are different people, different stages of their life, different types of lives as well, and obviously different ethnicities and genders here. But I think for anyone who's looking to get started, it's just finding someone you can look after, which Shawna did, is now going to fly off into space at some point. But finding someone you can look up to. And then for all of us, I'm pretty sure we're all approachable at some point, and we've had someone we've been lucky enough to just go and chat to. And that's the great thing about expedition humanitarian medicine. I think it's just so open compared to the other parts of medicine that is, Shawna's mentioned, is toxic and it's just not as open, but we are open as a field for sure. So yeah, just look for someone who you can look up to and get advice from, and start your journey as soon as possible.
Yeah, and they are out there. So if anyone's listening, or to whoever is listening to this, people will help you. Network, get in touch with WEM. There's a lot of people you can reach out to, and we'll find a way to get you in and get you on this journey. I want to thank all the guests we've had today, guys. It's been a wonderful conversation, and I've learned so much from all of you, and we've learned so much from each other, and we're all going to go back feeling really inadequate now, because you guys do so much stuff. But I really hope for those listening, it's been a wonderful insight into your journeys and how we've ended up where we are. And I think, just to have the final closing remarks, I think we should just believe in ourselves. And I think all of you have just believed and have held on to that belief throughout your lives. And if anyone out there is listening thinking they're not adequate and they don't have the skills, you do. You have that light, you have that power in you. So just believe in yourself, take the step, and just go forwards and don't look back. And providence, or whatever you want to call it, something will help you out. You'll find your way, and then you'll see the beauty of life. With that, guys, I'll wish you a good evening or a good afternoon, wherever you are, ladies. Burj, Chern, Hareen, Terez, Shawna, thank you so much. And we'll speak again. Take care.
Thanks for listening to the episode. Please feel free to rate, review, and subscribe on whichever platform you're listening to. Please also head over to the World Extreme Medicine website, where you can find more engaging content on extreme medicine webinars and indeed the collection of courses from our global network, including humanitarian, disaster relief, expedition, space, military, tactical, and performance medicine. Thanks again.